Hi, Dr. John Torres with NBC News on this Facebook Live. Dr. John with NBC News, as they call me, and I'm going to go over President Trump's timeline of what happened over the last few days when he went into the hospital because of his COVID-19, left the hospital, and subsequently what happened in between that time frame. A lot of things are still a bit confusing because we're not getting all the information, but here's the information we have so far. And also at the end of this, if you have questions pertaining to President Trump, what's going on right now, his hospitalization and his care, please send them our way, and I'll try to get to as many of those as I can. But let's start off with, if you remember last week, so today is Tuesday, October 6th. If you remember last week, we started hearing about him having tests that were negative, positive, and different things that are going on around a time frame. But here's what we know from briefings and from the medical team and from other information we have. Thursday afternoon, the medical team repeated testing of the president following news of a close contact. That close contact was Hope Hicks, who had been diagnosed positive with coronavirus. The president and Hope Hicks had traveled the day before, and so there was a concern that the president would be positive. Initially, it didn't look like he was, but then his test came back positive, and that's when things started getting concerning. Thursday afternoon, he got repeat testing to find out if he was positive. Thursday, later in the day, he started getting mild symptoms, particularly a cough, some congestion, and fatigue. That cough and fatigue are going to be playing a role throughout these next few days because those were the main symptoms they were telling us about. And then Thursday night, he got PCR confirmation of being positive. Now, again, we've talked about the testing. There's two different types of testing. There's the rapid test, which is an antigen test, and that tests for particles of the virus that might be around. That antigen test isn't as sensitive, isn't as specific if you don't have symptoms. So in other words, it's not quite as accurate if you don't have symptoms of it, and it can give you false negatives. It can give you a negative when in fact you do have coronavirus, and that's one of the big concerns. So when he got the negative tests, but he was exposed, they decided to move on to the PCR testing. That's the preliminary chain reaction testing. And what that is that looks for genetic parts of the virus. It takes those genetic parts and it amplifies them. They're called cycle thresholds. They keep moving through these cycles until they get either a positive or they've done enough cycles that they realize it's going to be negative. So that's much more accurate, but it takes more time to do. And I don't want to say it's much more accurate. It's more accurate. Between the rapid tests and the PCR tests, we're still talking accuracies. PCR test in the high 90s, the rapid test in the mid 90s, or it could be even lower than 90s if somebody's not symptomatic and they don't have that much virus. And so anyway, Thursday night he got that PCR test, which is the more accurate test, and it came out positive, which meant that yes, he did in fact have COVID-19. And remember, he did have those symptoms. According to the doctors there, Dr. Connolly, he said later on that the president was doing well. He had mild symptoms, and he had oxygen in the high 90s. That's important because this is a respiratory virus, and it's going to come into play later on with some of the subsequent briefings they had and some of the things we heard about. Then Friday, we're not exactly sure when, he started receiving an antibody cocktail. That antibody cocktail is from a company called Regeneron. And initially you heard polyclonal antibody cocktail. It's not polyclonal. And Regeneron actually sent myself and others an email saying, say polyclonal is incorrect. It's actually a combination of two monoclonal antibodies. And those two monoclonal antibodies are put together in a cocktail, and the president was given those. So far, these are used in clinical trials. They can be used on what's called a compassionate use basis, which means the physician has to apply for it. And then the company, FDA, decides, okay, does this patient warrant having compassionate use? In the president's case, they said yes, he got it on a compassionate use basis. From what we understand, there have been very few people who have gotten it this way, but others certainly have. And there's been a couple thousand people that have gotten it through clinical trials, or at least we think they have because the trials are still ongoing and we won't have all the information until they're complete. But anyway, he got that Regeneron. The purpose behind that is it's an antibody cocktail, monoclonal antibodies. So what they do here, you've probably heard of convalescent plasma. Convalescent plasma is plasma from a person who's recovered from COVID-19. They have antibodies. You take the plasma out of them. It's basically like you're donating blood, but they take out the plasma. They give you the other parts of the blood back. They take that plasma, they filter it out, and they go ahead and give that convalescent plasma that's rich in antibodies to somebody suffering from coronavirus. Well, monoclonal antibodies kind of takes that one step further. They take some of those antibodies and they start replicating those in the lab, and so they make a robust amount of antibodies, and they'll give them to a person. In Regeneron's case, with their with their monoclonal antibody cocktail, they ended up using 2 different monoclonal antibodies, combining them together and giving them to President Trump that way. So he got that on Friday. And then later Friday morning, we found out that the president had a high fever. His oxygen saturation dropped below 94%. That's going to come into play later. And this meant that they were concerned about the progression of the disease. So they started him on oxygen. He was on it for about an hour, we think. We think he was. And again, basically rested for the remainder of the day. According to Dr. Connolly, he was up and out of bed with only mild symptoms. And they decided essentially, because of that oxygen saturation, because of that oxygen level dropping, because his symptoms were that fatigue and that cough, which are some of the telltale symptoms of coronavirus, that they said, hey, let's go ahead and move him to Walter Reed just to be careful. Now, the advantage here is, yes, at the White House, he has a medical team, he has medical care, but it's essentially a clinic they have there with some extra equipment, and they have a medical team there of doctors, physician assistant, nurses that can watch him around the clock. But they don't have the intensive care he could get at a hospital like Walter Reed. The reason they sent him to Walter Reed, of all hospitals, is because that's the one that's specifically set up to take care of not just this president, but the presidents we've had for the past many, many presidents, because they have a special suite set up just for them to take care of them. Because as you can imagine, the president is a very valued person to be taken care of and to make sure they stay healthy. It's extremely important. So they ended up going to Walter Reed Friday evening, and had a good movement there. He continued to get he'd already gotten the Regeneron. Friday, he got also a dose of what's called remdesivir. Remdesivir is an antiviral medication. He got that as well. That's a 5-day course of antiviral medications he ended up getting. And so he started getting that on Friday as well. And that's also going to come into play as time goes on. So that was Friday. He ended up going to Walter Reed. And then Saturday comes. Saturday, again, one of the things they noticed is that his oxygen level dropped again, this time down to 93%. Now, for coronavirus, 95% or above is where you want their oxygen level. If it starts dropping below, then that gets concerning, because that means that it's affecting their lungs. Remember, this is a respiratory virus. If it starts affecting their lungs, the concern comes in that it's going to progress to something even worse. And so that's one of the reasons they started him on the remdesivir. It's unclear whether on Saturday he actually had to go on oxygen or not. We know Friday he did, because Dr. Connolly told us so. But Saturday he wouldn't answer the question directly about him going on oxygen. And so we're not exactly sure what happened. But the other thing is the doctors, Dr. Connolly and his staff of doctors that were taking care of President Trump, came out and had a briefing. In the briefing they said, quote, "The president is doing well." But they also said that 7 to 10 day period after the start of symptoms, that's the most critical to determine the course of this illness. Now, according to the timeline, he started his symptoms on Thursday. So if you look at 7 to 10 days, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. So Thursday through Sunday are going to be the most critical time periods to see how this disease is going to go. And one thing we know about coronavirus is they can get symptoms can get better, and then all of a sudden they can get to the point where they are having issues. They have gotten much worse, and they're having problems. And so the concern is what's going to happen Thursday through Sunday. We'll all be watching there to see what might happen, and hopefully not much does. They said on Friday he still had cough, he still had fatigue, but they were improving. And they did say 48 hours ago, which would be Thursday, he was given the Regeneron monoclonal antibody cocktail. On Friday, he was given his first dose of remdesivir. It's a 5-day course, and so he'll go through. Today will be his last dose of that. And so that is Saturday. And then Saturday, he ended up convalescing the rest of the day there. On top of that, they also said, and I'm referring to my notes because I want to make sure I'm very specific on this, he also said they started him on dexamethasone, and this is the one that caused a lot of conversation around the country. Friday, I was on our NBC News platforms, and I said, he's on remdesivir, he's on the monoclonal antibodies from Regeneron. Those are ones they give early in the disease process. And so that makes sense. If they put him on dexamethasone with a steroid, that's going to raise a few red flags, because that means he's doing more, that his symptoms are more intense than just mild symptoms of a little bit of cough, a little bit of fatigue. Well, Saturday, they end up putting him on dexamethasone, the steroid. Now, this is why this is important. That steroid, per the NIH, is reserved for people that are either on a ventilator or on supplemental oxygen hospitalized. They recommend against, specifically they recommend against giving it to patients who are not on a ventilator or not on supplemental oxygen. Well, other doctors are saying, including the doctors on his team, other doctors are saying that because of those 2 drops in oxygen level, that puts him in a severe category of symptoms from coronavirus. Not mild or moderate, but severe. And once you get into that severe category, even though the NIH recommendations are to only use it if you're ventilated or supplemental oxygen, that you should still probably use it in this case. And so that's the concern there, is we're hearing about these mild to moderate symptoms, but they're giving them a medication for patients with severe symptoms. And then at the same time, this will come into play the next day when he ends up going back to the White House. You send somebody back to the White House who's on severe symptoms. That's a big concern. So as of Saturday, he had gotten his dose of Regeneron, the monoclonal antibody cocktail. He had gotten multiple doses of remdesivir, the antiviral, and they started him on dexamethasone. The reason it's important to reserve this for patients who are severely ill, who are on ventilators, who are on supplemental oxygen, is because that steroid, one of its purposes is to basically tampen down the immune system. The reason they give it to patients that have progressed that so far into the disease is because one of the issues they're having is their immune system has gone into overdrive and it's starting to attack the body. That's that cytokine storm you hear about, and that can be deadly. So they want to give that steroid, and it's the only medication to date that is actually shown to be life-saving when it comes to COVID if given at the appropriate time frame. The concern is if it's given early on, mild to moderate symptoms, when your body's trying to fight off the virus, then it will tampen down the immune system and it won't let your immune system fully function and fully fight off the virus. And that's why there's a thin line between when you give it and when you don't give it. And they cross that line into giving it, which might be appropriate, but from what they're telling us, he's not having those severe symptoms. And so that's a concern as well. So anyway, that was Saturday. And again, he was put on the monoclonal antibodies up until then, remdesivir and the steroids. He got a second dose of remdesivir on Saturday. According to them, he tolerated it well. Oxygen levels were good. They did say that on his CT scan that he had some findings that were expected findings. And I'm sorry, that was on Sunday. So we'll stay with Saturday. So that's what they did on Saturday. And then switching to Sunday, on Sunday when they came out for a briefing, they said he had frequent ups and downs. He ended up having 2 episodes of drops in O2 Friday and Saturday. They acknowledged that. They said Saturday had dropped to 93%. Earlier they had said Friday had dropped to 94%. But they also said that he was only placed on oxygen at one time, as far as we know. But they gave out some indications that possibly he was placed on oxygen twice. They started at dexamethasone, and they said his CT scan of his lungs showed quote-unquote expected findings. That caused a bit of confusion as well. The reason it caused confusion is because if he has severe illness, if he's had a drop in O2 sats, expected findings would be what we call ground glass opacities on the lung. In other words, the lung looks like it has ground glass in it, and that's a very distinctive finding for coronavirus pneumonia. If he has that, then again, that means his symptoms are more severe and there's more concern over it. So anyway, that's Sunday. And then ended up as well on Sunday, he ended up leaving. Wait, I'm getting my time messed up, but here's what happened. In their conference, they also said that while he may not be out of the woods, he will be, basically, his symptoms are getting better. He may not be out of the woods yet, but he's going to be around 24/7 care. So they want to make sure that everything's going well. And so they ended up subsequently, and here's kind of the timeline as things are working out. Yesterday, Monday, they said, okay, things seem to be doing better. Let's go ahead and get him back to the White House. Now, there's some speculation as to whether they sent him back because they thought he had progressed well enough to where he could go back, or they sent him back because he was demanding to go back and they had no choice. Now, whether you're the president, whether you're who, it doesn't matter who, in the middle of the country, if you're at a hospital, what I tell people all the time is you are the driver behind your own health care. You are the decision maker. As a physician, as a medical team, we give you our best medical advice. We give you the advice we give you to save your life, but as long as you're coherent, as long as you're competent, mentally competent, then you are free to make your own decisions. I cannot hold you in a hospital against your will. And I'm sure that his doctors at the same time are saying the same thing. This is probably the best thing for you, but you have to make the decision on where you want to go with this. Regardless who made the decision, he ended up going back to the White House. And so he went to the White House, but the thing you have to realize, him going to the White House is not like you or I going to our house. He's not going to be sitting on a couch having his wife or husband or kids take care of him. He's basically at 24/7 care. He's got a medical facility there. My guess is they moved in extra equipment, and they're going to keep a very, very close eye on him. Now, if you saw yesterday when he went back to the White House, he got in a helicopter at Walter Reed, ended up helicoptering into the White House grounds like they normally do, and walked from there up into the White House. When he left the helicopter, he was wearing a mask. That is fantastic because so far, and this happened yesterday, Monday, so Thursday, Friday, Saturday, Sunday, Monday. He's 5 days into this illness. According to the CDC, they consider you contagious for 10 days after symptoms start. That's when you can be around other people. They say after 10 days, you can be around other people, assuming your symptoms improve, which they're saying his do, and you're fever-free for 24 hours, which it seems like he is as well. But the concerning thing is he's at 5 days, not 10 days. And so if he's at that 5-day mid-period, then it's possible he's still contagious. And yesterday, the CDC put out a notification saying, hey, we have also found out that this spreads through the air by what we call airborne transmission. It's not the most likely way it's going to spread, but it's one of the ways it can spread, meaning small particles can get in the air for longer periods of time than we thought, and they can travel further distances. And so the concerning thing is, if you saw him yesterday when he got to the White House, had a mask on, got out of the helicopter, got up to the top of the stairs, and then stood there for a photo op, took his mask off. To me, as a public health official, that's concerning because I think it sends a message that, hey, I'm no longer contagious. I can go ahead and take my mask off. No, he is still contagious at this point. He's considered contagious at this point. And then he walked in to do a video with other people around. Remember, that airborne spread means that those viruses that he's spreading through breathing, through talking, are going in the air, they're lingering around, and the other people around him, even though they're wearing masks, are still possibly affected by that. So you have to be very, very careful. The best thing from a public health perspective would have been for him to continue to wear the mask. Now that he's in the White House, he needs to be isolated. And isolation means exactly that he's not around other people. Unless the other people who come in are coming in for very specific, usually health-related purposes. They're wearing masks, you're wearing a mask, the President Trump's wearing a mask, and so that way everybody's as protected as possible. Time will tell what exactly happens there. But as you can see, the way the scenario played out, he got sick, he got better, he got put on certain medications. Now he's still on, today's the last day of remdesivir. He's still going to be on dexamethasone for another day, that steroid. But the concerning thing is even his doctor says that 7 to 10 day period is going to be the important period to finding out what happens. That is Thursday through Sunday. And so we're at Tuesday right now. So over the next couple of days, it's likely and it's hopeful that his symptoms will continue to improve. But it's also possible that his symptoms will improve today, tomorrow, Thursday, and then Friday start getting worse, and then he'll need to go back to Walter Reed to get care there. We hope not. We hope the president gets better, continues to get better. We hope the First Lady continues to get better. But as you can see, this is a very confusing picture. And I think the message that sends out to the rest of us is that coronavirus, we need to take very serious. We need to do those things we need to do to protect everybody else. Wear masks, watch your distance, wash your hands, and open windows so you can ventilate things. And if you do get sick, make sure you take those isolation precautions extremely serious. And also realize that testing isn't the end-all to everything here. Testing is not the perfect panacea. We had multiple examples here of people who tested negative one day, went without masks, went without social distancing, and only to test positive a day later, and then people in between there had gotten infected. And so again, realize if you get a negative test, that's not your free pass to go ahead and go without masks or social distancing. Even though you test negative, you still need the mask, you still need the social distance, because that test is just one snapshot in time. As soon as that test is done, things could change the next hour. So you need to be very, very careful with that. But again, we hope, as everybody does, that the president does well, that the First Lady does well, that those that are sick with coronavirus around the world do well as well. And hopefully we learn more from this as to what we should do, and particularly what we shouldn't do to keep it under control, and what we can do ourselves to help make sure this pandemic ends as soon as possible. So I want to thank you, and I hope, like normal, you have a very happy and you have a very healthy week. Thanks.